Hello, and welcome to part 3 of Contemporary Perspectives on Abnormal Behavior. I'm starting where I left off, which is on social learning theory, which is one of the specific learning theories or behavioral theories. According to social learning theory, as you can see here, behavior is learned through modeling. And that's something that, again, I think that we really take for granted these days. We say, of course, behavior is learned through modeling. When you see someone else do something, you might try to do that thing as well. But again, that was really innovative, particularly in the 50s when Bandura conducted the Bobo doll experiment. You'll see that I have a link right here on my slide to a YouTube video. I put that same link on Moodle, so go ahead and check it out and it'll tell you all about the very interesting Bobo doll experiment. It actually has some clips from the original experiment. It's really fascinating. And it demonstrates how um, when we are confronted with a new or a novel situation, if we see someone act in a certain way in that situation, we're more likely to do the same thing or to act in the same way. So again, just demonstrating the power of modeling. Okay, so if we're going to apply behavioral or learning perspectives to the case of Steve V, if we're looking at it through that lens, it might sound something like this. The roots of Steve's problems can be traced to his behavior. Many of the behaviors he has learned are inappropriate and he lacks useful, productive behaviors. He has had little practice in social relationships, lacks good role models, and has difficulty distinguishing between appropriate and inappropriate behavior. Furthermore, his delusion that he is controlled by demonic forces may be unwittingly reinforced by those around him. Unwittingly reinforced meaning basically accidentally reinforced by those around him by maybe giving him attention when he acts on those delusional thoughts and so on. When Steve discusses or acts out on these beliefs, he garners much attention from others. And so if this is the way that we would conceptualize the case, then the treatment recommendation would be behavior therapy that includes modeling and role modeling to enhance Steve's social skills, and a reinforcement program to eliminate or control his delusional thoughts. And just a note, in one of our upcoming topics, we'll be talking about methods of treatment, so we'll talk in much more detail about what that would look like. Okay, so just to evaluate some of the pros and cons of learning models. One is that the learning models are very effective for changing undesirable behavior. Specifically, parent training in the use of positive and negative reinforcement techniques is generally very successful. So as a child psychologist, I find these behavioral strategies to be really, really useful in working with kids. The one critique of behavioral and learning models is that it's really important for us to be mindful of the fact that humans are motivated by more than just environmental influences alone. So, we need to take into consideration emotional experiences and things of that nature, and learning theory does not take that into consideration. All right, so moving on to the next psychological perspective, the humanistic model. The basic premise of humanistic models is the idea that all people strive for self-actualization, or the idea that we're all striving to be the best we can be by building on our unique talents and traits and being true or authentic to ourselves. So there are two big players in the humanistic world, Carl Rogers and Abraham Maslow. Rogers was really focused on highlighting the uniqueness of each person, this idea of unconditional regard, accepting a person no matter what, and the fact that all people need that and require that. Conditions of worth is another concept that Rogers brought up. He talked about the importance of, as a child, and I think even as an adult, getting acceptance no matter what we do. On the other hand, conditions of worth is when a child is accepted only when they behave in a certain way. Because then what happens is that the child learns to think of themselves as worthwhile only if they behave in these quote unquote approved ways. And so when we see individuals who have grown up in situations where there were conditions of worth, that's something that we would address in psychotherapy. Congruence, the result of experiencing conditions of worth is that a child can develop a distorted sense of self-concept, meaning they might not be true to themselves because they're constantly attempting to be what they think others want them to be. And Rogers was also really focused on the importance of fostering the therapy relationship. So he developed what's known as client or person-centered therapy, which involves providing the client with that unconditional positive regard that they were lacking and helping them kind of get in touch with their true feelings, accept themselves, and helping them act in ways that truly reflect their own desires and wishes. On the flip side, Abraham Maslow, he came up with this hierarchy of needs. And so he talked about the fact that we have all of these needs: physiological needs, safety needs, the need for belonging and love, the need for self esteem, and then self actualization. And the thing that he pointed out that's really important is that, so for me as a therapist, if I have a client who's coming to see me, but their physiological needs are being met, meaning they don't know where they're going to get their next meal or they don't have a place to live, then I'm not going to be working with them on improving their self esteem because that first need there hasn't been met. And so that needs to be met first. And they really need to be met in this order before you could work on the higher order needs. So from a humanistic perspective, here's how someone might conceptualize Steve V's case. Steve is a flesh and blood person, alive, organic, and moving with thoughts, feelings, and emotions. I object to the use of diagnosis because labels serve only to pigeonhole people and act as barriers to the development of a therapeutic relationship. So humanistic therapists generally are averse to diagnosis. In an attempt to understand the subjective world of Steve's experience, a humanistic theorist might say that he seems to feel trapped, immobilized, and lonely, and that he is externalizing his problems. He might be evading responsibility for making his own choices and protecting himself by staying safe in the safe, known environment of his illness. And so, for treatment, it's important for him to realize that he's responsible for his own actions and that he cannot find his identity in others, and that life is not predetermined. So, that would be a humanistic conceptualization. So moving on to the next psychological perspective, the cognitive perspective. The focus of cognitive theorists is on cognitions or thoughts, beliefs, and expectations. And the premise here is that each of our realities is really shaped by our expectations or the way that we perceive situations. And inaccurate or biased processing leads to abnormal behavior, according to this model. So again, according to the cognitive model, our interpretations or thoughts about an event influence how we feel and act. So thoughts and beliefs about the experience cause distress, not the experience itself, according to a cognitive theorist. According to this model, the kinds of thoughts and beliefs that lead to distress are irrational thoughts and self-defeating thoughts, as well as inaccurate perceptions or interpretations of a situation. A good example of this is that aggressive teens tend to perceive others' behavior as threatening. So, if somebody bumps into you in the hall, their first thought is that the person was out to get them and not that maybe it was an accident. Aaron Beck came up with this cognitive triad that depression results from cognitive distortions or errors in thinking related to the self, this idea that yourself, that you are worthless, the world, that the world is generally unfair, and the future, that the future is hopeless. And so in treatment, cognitive theorists help clients examine and change these cognitive biases or cognitive distortions. So when it comes to irrational beliefs, the kinds of things that you would identify as a cognitive therapist are beliefs like these. This idea of, maybe wanting everyone to like you, or that it's not okay if I make mistakes. So you might identify these irrational beliefs and then challenge them. Is it really possible for everyone to like everyone? Or is it, what about the fact that you're human? Is it okay to make mistakes? What can you learn from making mistakes? So challenging those beliefs, thereby helping the person to deal with any symptoms of sadness or anxiety that they might be experiencing. So rather than taking the time to read this whole thing, I'm going to have you pause it here for a second and just take a look at the cognitive conceptualization of Steve V's case. Okay, so moving on to the last psychological perspective, the sociocultural model. This one's a little bit different than the other models that we've talked about. The focus here really is on the influence of social and cultural factors on abnormal behavior. So these factors like prejudice, poverty, inequities related to sexual orientation, race, and sex, they really influence the development of abnormal behavior. And what the research tells us is that people who are exposed to higher rates of stress and lower socioeconomic status are at higher risk for being institutionalized for psychiatric problems and for the development of certain disorders, such as schizophrenia. To understand this phenomenon, two models were developed. They're similar, but they imply different things. So the first one is the social causation model. And this model says living in poverty exposes people to more social stress and results in people from lower socioeconomic status groups being at higher risk for psychiatric illness. So living in that poverty situation and the stressors associated with that increase the risk for disorders. The second one is the downward drift model. This model suggests that the development of psychological disorders like alcoholism or schizophrenia causes people to drift downward in social status. So this one suggests that the disorder itself causes living in poverty, having low resources, losing social connections and the like. Okay, and then the last perspective that I want to talk about is the biopsychosocial perspective. And this really attempts to consider multiple perspectives simultaneously by considering the influence of biological factors and the influence of environmental factors. So this is a good model here to show you kind of how our health, both our physical health and our mental health, are affected by a number of factors, including the environment around us, the behavior around us, and our own biology. One really important model to come out of the biopsychosocial perspective, and that you're going to hear me talk a lot about this semester, is the diathesis stress model. And what this tells us is that, generally speaking, for most disorders, an individual may have some sort of diathesis or a predisposition or vulnerability. So what that refers to is some sort of inherited genetic predisposition to develop the disorder. Now, that alone does not result in the development of the disorder. What you'll see here is that what you have to have is this predisposition plus the exposure to some sort of environmental stressor, whether that be a prenatal trauma, childhood sexual or physical abuse, family conflict, some really significant life changes. Those two things together are what results in the development of most psychological disorders. And what's an important note here is it says that the stronger the diathesis, so meaning the stronger the genetic predisposition, the less stress is necessary to produce the disorder. And so we're going to see this diathesis stress model playing a role in the development of a lot of the psychological disorders we'll talk about this semester. Okay, so that wraps up the discussion of contemporary perspectives of abnormal behavior. I know this was a lot of information, so when we meet next in person, I will certainly give you opportunities to ask as many questions as you have about this material. Thanks, and I will see you all soon.